Hi everyone, and welcome back to the GuideWell Insights Lounge. Thank you for joining us at the end of day one of Singularity University's Exponential Medicine. My name is Kate Warnock, and we have a very distinguished guest with us here today at the Insights Lounge, Dr. Rafael Grossmann. Dr. Grossmann, welcome.
Thank you very much, Kate.
So Dr. Grossmann is a very accomplished general trauma and advanced laparoscopic and robotic surgeon, but you also have a side job too, Dr. Grossmann. Why don't you tell us a bit about that?
Yeah, well, what you mentioned, Kathy, is my regular job, my full-time job. I'm a clinical surgeon. I see patients, day and night, but in parallel to what I do as a physician, I have become some sort of a healthcare futurist, a healthcare innovator, technology innovator,
Right.
and a global speaker. And that's in parallel to what I do, during the daytime, I guess.
Well, and I think one of the reasons why you are recognized as a healthcare futurist is because you're one of the innovators of actually using Google Glass in the surgery room. So tell us, how is it that you think that integrating this really advanced futuristic technology like Google Glass is really going to become more and more embedded in the clinical practice?
Well, when I used Google Glass in surgery, it was the first time that it had been used in surgery, and it was really a pretty simple, intuitive use of the device, the way it comes out of the box. Basically, all I did was I streamed a simple operation, a gastric operation. Okay. After getting the patients and the families' permission to do so, I streamed the point of view of the surgery, of my point of view of the surgery, to a group of students in a nearby room. So rather than having the students crammed behind me trying to watch, or rather than watching a video of a recorded surgery, what I did is I connected them live through a live stream through the Google Glass with audio and video, so that they could ask me questions and answer questions, and at the same time look at the same point of view that I was having.
Right.
And it was something really simple, but it had never been done. And again, it was the first time that Google Glass was used in the operating room, and that caught a lot of attention, obviously. And that, I think, set up the stage for a new wave of thinking in regards to how to use wearable computers or smart glasses to help in the industry, in this case, healthcare.
Right. Well, so Dr. Grossmann, in your opinion, what role does the physician-to-patient contact play in the healthcare system of tomorrow, especially something like Google Glass? So you're talking about the connectivity with medical students. Could there be that same kind of connectivity with consumers and patients themselves?
Absolutely. One very common, I would say, mistake that people assume is that technology will separate, in a way, the provider and the patient. And I think it's completely the opposite. I'm a big fan of telemedicine. That's how I started, virtual presence medicine, using technology to basically put together the physician, the provider, and the patient. And I think that a Google Glass, a wearable computer, a smart glass is really the representation of that. I think that rather than separating, you actually get closer to the patient because you give the physician and the patient more access to each other. People talk about technology depersonalizing medicine in a way, and I think, again, it's the contrary. I think that you've been to the doctor probably, and the first thing that happens when you go to the doctor's office is the physician turns away from you to a computer.
Right.
When you have the computer in front of your face, you can actually maybe access whatever data you need
Right.
to access in regards to taking care of you without having to, turn my body, my face, my eye contact from you. So I think that it in a way, brings physician and patient together.
It really sounds like you're leveraging technology to humanize the experience.
Absolutely.
So even though there's technology there, it's not a barrier. It's really helping to enhance that experience.
Yeah.
So Dr. Grossmann, another question for you. We know that there's such a thing as the empowered patient. There's lots and lots of conversation about that. Can you tell us, what do you think the empowered physician is going to look like?
Well, that's a great question. I think that the empowered physician, the physician of the present almost, but certainly of the future, is a physician that is able to use technology in a smart way. A physician, a provider that is connected, a physician that is well versed in the use of the technology that has been created maybe for play, but to use it to treat patients, to keep health, to heal patients, to rehab patients.
Right.
I think that that's very important. I think that we take for granted certain devices that can be certainly used for patient care, and they're not being used for patient care. In 2011, I had the privilege to do a TEDx talk, my first TEDx talk. It was about the use of iPod Touch devices to do acute trauma consultations. We have a vast telehealth network where I am in Maine, and basically we have 17 hospitals connected to the main hospital. So if any provider at the outside hospital needs to have a consultation, needs some expertise in regards to treating a trauma patient, we would use one of the big screens or big cameras, very expensive, very hard to maintain systems in order to connect with them. So when the iPhone 4 came out with FaceTime, I had the thought of why not using this type of technology to connect, patients and providers separated, hundreds of miles, and we did it and started talking about it, and then the industry eventually provided a FaceTime for healthcare. FaceTime that was encrypted and HIPAA compliant,
right.
And within just a few months, we installed an app basically in our iPhones or devices that we could use for doing that. So a device that was used to listen to music and to play games was being used to save lives factually. So
it sounds like really what you've discovered is an organic way to integrate this technology in a way that makes it easy to use, but it really does, as I would say here, exponentially improve the outcome and the experience both for the patient and for
Absolutely.
the clinician. So I would be completely remiss if I did not ask you, a medical futurist, what is it that you think you will see in healthcare 3 to 5 years from now?
Well, it's I always say that our imagination and creativity are the only limits to what healthcare is gonna be in the future in regards to its interaction with technology. And listening today to people talking about robotics and artificial intelligence and deep learning, I'm completely convinced that within the next 3 to 5 years, we'll have, for example, medical specialties completely displaced and make them disappear with the use of deep learning technologies, so deep learning algorithms. For example, radiology, pathology, those are medical specialties. I mean, you go to med school and then you go to a residency for 3 years or so to become a radiologist or a pathologist, and all you do really is analyze and look at data and analyze it in your brain and then come up with a report. Our specialties that in general, most of the specialty doesn't have any direct patient contact. So those specialties are are going to be the ones that are going to go first. I think that luckily, I think surgery is going to go last, in many years from now. But I think the pathology and radiology, in a way, are going to be displaced by technologies that use deep learning to identify images, to identify, cells that are abnormal or fractures or abnormalities on an imaging study. So I think that deep learning, robotics, certainly genomics, nanotechnology, the combination of those 4 variables are really going to change the way we see medicine. I think it's going to take a long time, but I think deep learning will definitely impact medicine the quickest. And I think that within 3 years or so, we're going to see a very different healthcare in many ways in regards to this interaction.
Well, Dr. Grossmann, I wonder too if there is something to be said. We just had Greg Matthews on. Greg Matthews is the managing director of W2O Group, more importantly, the creator of M Digital Life, where he is talking about how the connectivity between physicians, patients, even policymakers, reporters, is becoming that much more important and accessible. I know you yourself are very active in social media. I was hoping you could maybe speak a little bit more to your website and your social address.
Yeah. Well, it's funny. I attended FutureMed in 2013. FutureMed is what exponential medicine was.
Right.
It evolved to exponential medicine. And on the plane back from the NASA research facility in Silicon Valley to Maine, I started writing a blog, basically, and that has become now my main blog or website, which is basically myname.com.
Right.
And every few weeks, once, if I have something important to tell the world, I post about it. But also, I'm a very big fan of social media for healthcare. I use it only professionally. I don't use it in a personal way. I don't even have a Facebook page. People don't sometimes believe that. But I'm a big user of Twitter and of LinkedIn as well. Twitter is really the main way that I communicate any healthcare related ideas, or the main way that I get any links or
Right.
information from the world in
Right,
regards to what
right.
I do in healthcare futurism.
Could you tell our audience where can they find you on Twitter?
Yeah, my Twitter is it's my initials backwards. It's a ZGJR.
ZGJR,
Z as in
terrific.
Zorro, GJR, and it's pretty simple. I want to keep it short so people have extra
More characters, that's
letters
right.
and characters for. But yeah, it's been really an enormous a source for me of accessibility to people.
Absolutely.
And you start tweeting interesting stuff, and people start following and retweeting, and when you you get an idea out, so suddenly the idea is exponentially
That's
brought
right.
out to the rest of the world. So
That's
it's pretty it's a fun way to do it.
Well, I'm looking forward to seeing more of what you're going to be sharing out on your Twitter and on your blog. We will be sure to follow that and be sharing that with our social audience too, Dr. Grossmann. Thank you so much for joining us today here at the Guidewell Insights Lounge. We will be joining you again again tomorrow, day 2 of Singularity University's Exponential Medicine. Thanks for joining us.
Thank you very much.